Turn to our earlier story. Dr. Zweli Mkhize, Health Minister, touring facilities in the Eastern Cape where there is a concern about rising COVID infections. At the same time, Nehawu staging a protest outside Livingstone Hospital. Conditions there, of course, earlier made international news during lockdown, given the poor conditions that COVID-19 and other patients were subjected to. Let's chat to our reporter, Lwando Nomoyi. Lwando, thank you for being with us. How bad is the COVID situation in Nelson Mandela Bay? We know that is the focus right now.
Well, thank you very much, Francis. As you know, during the president's speech last week, where he alluded to the fact that the Nelson Mandela Bay Metro has become a hotspot within the country due to the rising numbers, which was an area of concern to various delegates, including a delegation that was led by Dr. Zweli Mkhize, the Minister of Health, and other delegates from the Department of Health within the province of the Eastern Cape. And also another alarming district to mention is the Sarabatman district as well, with rising numbers. You would remember that during the month of July and August there were no active cases in that particular district, but now there have become so many active cases within that particular district, which is now a concern for the health department as well, that public hospitals and private hospitals are buckling under the pressure in terms of the spaces available, in terms of beds, oxygenation and ventilation as well. But during the visit of Minister Zweli Mkhize this morning, he alluded to the fact that indeed there is sufficient oxygenation, there is sufficient ventilation, there is sufficient beds in the metro. An area of concern was the exhaustion of staff, other staff, from health, succumbing to the virus, and some others, migrating from the province, finding employment elsewhere, and some taking retirement as well. But however, presentations were made to the minister, in terms of, intensifying the fight against COVID-19 within these two metros, and that the fight against, poor adherence, that people have let their guard down in terms of wearing masks in public spaces and to continue to sanitize, and more especially the queues you would see at the post offices. Those were also an area of concern that caused the super spread in these areas.
All right. Did he mention at all? I mean, Livingstone Hospital is just one example. The reports that came out during lockdown, analyst after analyst that we have spoken to would say that there's a problem in the Eastern Cape, specifically in the health department. We've seen a weakness exposed during COVID-19. Did the minister seem to think that this province, in terms of governance, was problematic?
Well, definitely, Francis, you would be correct to say that. But, about 2 or 3 months ago, the former head of department of the health department in the Eastern Cape, Dr. Tobile Mbengashe, also alluded to this, that, the poor government and the management within the particular structures of hospitals is an issue. We understand that a while back, about 6 members of the board of the hospital of Doranginza were suspended by the former head of department, citing, to this poor governance, which led, to this hospital, making international news in terms of the state of its current state. But looking at today, and the visit by the minister, there is a change in the hospital. We remember that at one time there was a particular shutdown of the casualty. That was back in June, but ever since then things have indeed changed. People have indeed pulled up their socks, and we've also seen that there is a basement parking that has also been turned into a new ward, which has beds with oxygenation of about 74 beds, and also at Doranginza Hospital, another hospital that has been also making those headlines. Things have changed due to our observations when we were there. There's also a new wing that has been constructed with over 100 beds, all of them with oxygen. So the situation is getting better. It's not all hope is lost in the metro.
All right, thank you very much, Lwando. An update there on the situation in Nelson Mandela Bay and other parts of the Eastern Cape, visited by the Health Minister today. We take a short break, lots more to come on The Full View. Stay with us.